Welcome, everybody. Tonight, we have the pleasure of a community member, Dr. Lisa Kattan. She's a general dentist that has been practicing in Montreal for the past 8 years. She obtained her doctorate in dental medicine at Université Laval in Quebec City and completed her general practice residency at Université of Montreal. Lisa is a proud member of the Montreal Jewish Iraqi community. Without further ado, Dr. Lisa Kattan is going to talk to us about how to keep your pearly whites smiling. Go ahead, Lisa.
Thanks, everyone. I'm so happy to see you guys, and I'm happy to be able to present with you all. So let's get started. So, topics for today. We're going to cover some cavities, a little bit of dentistry for all ages, how to maintain proper oral hygiene, different types of treatments that you should expect at the dentist, and obviously now what you can expect when going to the dentist during COVID. So what is a cavity, also known as decay? So it's basically a permanent hole in your tooth. And they are actually one of the most common chronic diseases of childhood, second to the common cold, actually. And basically, where we see the cavities the most often is in the grooves of the back teeth. So you have little fissures in the eating surfaces, on the top surfaces of the teeth, and that's often where we see cavities developing. Evidently, a tooth is much stronger and healthier if it hasn't had a filling or if it doesn't have untreated decay, because it is still whole. Its structure is stronger. How does a tooth decay? So basically, when you eat food, it doesn't matter what, bread, gummy bears, chips, an apple, anything, the bacteria in your mouth, both good and bad bacteria that everybody has in their mouth, will then feed on the sugar. And this bacteria, as a produce, will produce acid. And this acid will then be the cause of the decay that starts. And really the danger sign is when you have plaque on your teeth. And plaque is like that little sort of whitey yellowish film that if you don't brush well enough, you'll see it on your teeth starting to develop. And basically that acid will stick into the plaque and start to make little openings in the tooth. And that's where we get the cavity from. So here we have the 3 different layers of the tooth. In the first picture, you see a healthy tooth. So basically what you're looking at is the enamel, which is the outer surface. In the second picture, you see the enamel, and then you see the cavity, or the decay as we call it, starting to form, going into the second layer, which is the dentin. As the cavity gets deeper, it goes towards the pulp. And that's where the tooth starts to become extremely painful in many circumstances because you're more likely to need a root canal. So cavities don't actually just form overnight. It can take months and up to years even. Normally, your mouth is at what we call a pH of 7. It's a very neutral pH. When it goes below 7, it is more acidic. And that usually happens in spurts. So when we eat foods such as apples, wine, coffee, lemons, those are all acidic, and they will bring the pH of your mouth down to a more acidic level. And it is when your mouth is at an acidic level that the damage occurs to the tooth surface. But if your pH goes back up, which it naturally does with time, and we'll discuss other ways to help make it go up again, your acidic or destructive phase will actually stop. And then the next time it goes acidic again, so the next meal, that's where the cavity will start and continue to go from where it left off. So how can we prevent getting cavities? Basically, to eat a well-balanced diet that is low in sugar and to avoid sugary drinks like soft drinks and juices. So I'm actually not going to say don't eat anything with sugar, don't enjoy drinks. my main goal is to tell you that you can eat as much sugar, I mean, not from a nutritious point of view, but you can eat as much sugar as you want, as long as it's in smaller periods of time. So you're not drinking your coffee from 8 a.m. to 12 p.m. all morning long, leaving your teeth bathing in the acid. But you drink your coffee in a normal, couple of minutes, 10 minutes, and then you can counter effect these effects of the acid with cheese, because cheese will help bring the pH up. You can rinse your mouth with water, swish some water around, or you can chew some sugar-free gum, something that will help get the salivary flow, to get your saliva flowing, to help clean out your mouth. It will bring the pH up and will also cleanse your mouth from whatever food bits are left. Other things that you can do are brushing with fluoride toothpaste. And I caps locked it here. It has to be fluoride toothpaste, because basically what we see is the fluoride, the mineral, will help remineralize whatever surface has started to be eaten away by the acid. And so maybe some of you will have had actual cavities, we could say, in your mouth, like a brown spot, like a brown patch. And your dentist says, no, we don't need to fill it because it actually has become hard again. Well, that is basically because of the fluoride minerals going into the tooth and re-hardening the surface. Also, flossing will help remove particles that become trapped of food between your teeth. So let's talk a little bit about cavities in kids. So the bacteria that causes cavities is actually not something that we are born with. That bacteria is something that is contagious. It gets transmitted from mouth to mouth. Your baby is not born with that bacteria. So examples of sharing saliva, the pacifier falls on the floor, if you put it in your mouth to clean it, or a spoon or whatever with your baby, that is a way that you will transmit the cavities or the bacteria that will cause cavities towards your baby. So kids who have older siblings or parents that have cavities are much more prone to having cavities themselves. And especially if those cavities have not been treated. So if a filling is good and there's no issue with it, they are less at risk. Obviously, children with special health care needs need a little bit of extra help to help prevent cavities. And children who wear, even adults who wear braces or oral appliances, just have a little bit more surface in their mouth for bacteria to stick onto. And as such, they are obviously at a higher risk for cavities. So cavities can actually cause a lot of pain and infections for anybody. But when you're a child, it can cause problems for eating, speaking, playing, and learning. And they've actually shown that kids with poor oral health often miss more school and don't do quite as well in school as those that don't have cavities. So let's go a little bit through some oral hygiene for all ages. So first of all, baby teeth, your primary teeth, start to form when you're in your mommy's tummy at 6 weeks, much earlier than probably most of you would have thought. And your adult teeth actually begin to form in mommy's tummy at 4 months. So let's talk about oral hygiene for babies. Essentially, you can just take a wipe, a soft, clean cloth, and you can wipe their gums in the morning and at nighttime before you put the baby to sleep. And when the teeth start to come in, I would suggest using a small toothbrush with just some water and just to start brushing the teeth. First of all, it helps remove the plaque, but it also helps the baby get used to having somebody play in their mouth and start to get used to the idea of oral hygiene. It's also recommended that you go to the dentist within the first year or the first birthday of the baby. So maybe the baby gets their teeth around 6 to 8 months. Anytime after that, before 1 year old, is a good time to go. And it's not because your baby's going to have an intense cleaning or anything. It's more of an appointment where the dentist will talk to you, give you some tips, tell you how to take care of the baby, and make sure that there are no problems afterwards. Now, oral hygiene for kids. Fairly simple, brush your teeth twice a day. It says to drink tap water that contains fluoride. That is not something that we have in Quebec. You can apply sealants to teeth and flossing. I usually do not like the flossers that you see here, but for dexterity purposes for a child, I think that it is better than nothing. And so cavities do form between the teeth of kids as well as adults. And so if it's their only way to floss, then I say go for it. So cavities are preventable. So how can you help your kids to help prevent those cavities? So if they're under 6 years old, you should probably be helping them brush, meaning let them brush on their own, and then you can help take over. You do an extra little cleanup at the end. Studies have actually shown that even under 8 years old, children just don't have the dexterity to be able to clean and brush their teeth properly. So they should use a pea-sized amount of toothpaste, and we rather that they spit it out than swallow it. If your child eats a bit of the toothpaste, it's really not the end of the world. It's small quantities, and especially in Quebec, where we don't have fluoride in our waters, it's really not a big deal. Other things that we can talk about is giving an oral supplement, drops, tablets, whatever, of fluoride if your child needs it. And sealants, which are fantastic. So as you see here, sealants basically cover the grooves, like we talked about in the back teeth, where are the most likely to have cavities form. And it's almost like a thin layer of nail polish. The child doesn't really feel it on the surface. And you see, it basically covers the surface of the tooth to prevent cavities. And it can actually prevent cavities for many, many, many years by blocking out germs and food that would then get stuck inside. And we place sealants, on the first molars, which come in around the age of 6 or 7 years old. And so you can understand that a child maybe is not able to brush so well on their back teeth at that age. And so that's why it helps prevent a lot of cavities. And if your child doesn't have the proper hygiene in the coming years, you can also start to apply sealants on the other adult teeth as they come in. So these sealants can fall off in between, and it's normal, and you can have them replaced quite easily at future visits with your dentist. And evidently, when the sealant falls off, your protective shield is not there anymore. So let's talk about pregnancy and oral hygiene. So good oral hygiene is extremely important during pregnancy because of your hormone levels. Basically, your mouth becomes hyperactive, hypersensitive towards all these bacteria and plaque, and it makes you more prone to gum disease and eventually cavities. And in fact, they have shown that 60 to 75% of pregnant women have gingivitis, gum inflammation. And this gum inflammation can lead to a preterm birth and low birth weight for the baby. So there can be actual serious effects by not maintaining your oral hygiene while pregnant. Evidently, your body changes through vomiting, through changing of appetite, will also put pregnant women at increased risk of cavities. So how to protect your teeth while pregnant? Definitely see a dentist. It is safe. And often I will tell my patients who are used to going every 6 months to the dentist to maybe go every 4 months so they can sneak in 2 cleanings during their pregnancy just to avoid any kind of problems. Brushing twice a day, and of course, flossing. So some tips. After vomiting, when you're pregnant and in general, if you do vomit, you should rinse your mouth with water. Do not brush your teeth. Literally, the acid from your vomit is sitting on your teeth. If you brush your teeth, it is basically like cleaning your teeth with acid. Not a good thing. So you want to wash the acid away from your teeth rinsing, chewing gum, like we had said before, eating a piece of cheese, something to get the saliva flowing, bring the pH back up. Now, let's talk about the baby boomer generation. So the majority of the baby boomers will actually end up keeping their natural teeth over their lifetime. And this is something that has increased a lot in the years because of fluoride toothpaste, and in other countries because of fluoride in the water. So you're still at risk if cavities are not treated and gum disease is not treated. So let's talk about the risk of decay. So it can increase with age due to decreased salivary production. And that's something we'll talk about a little bit more later, but as you age, you don't have as much saliva necessarily being produced, or you may be taking medications that may decrease the production or the flow of saliva. As well as you see in the picture here at the bottom, you have some gum recession, meaning this yellowier patch of the tooth is exposed. And that is no longer the enamel. This is the white part, the enamel, which is hard. It is actually the hardest surface in your body. It's harder than bones. So this part here, the root surface, is a more soft texture, and it is more likely to become decayed with a cavity than the enamel surface. And more risks can cause because of difficulties brushing, flossing, because of poor vision, cognitive problems, chronic disease, and physical limitations that may arise with age. This is a big one. We're going to talk about periodontal disease. Periodontal is just the gum and bone that surrounds the tooth. So periodontal disease is the infection and inflammation of the gum and bones that surround and support the teeth. In the early stages, it starts off as gingivitis, which is just maybe swollen, red, sometimes bleeding gums. But as it goes to its more severe stage, which is called periodontitis, it basically means that the gums start to detach from the teeth. You lose bone that is surrounding the tooth, and the teeth can become loose or even fall out. And so an example that I like to use is picture a lamp post or a light post outside that is stuck in cement. It is being held in cement. Now, if you lose the cement around it, the post will start to move. And so it's the exact same thing with your teeth. If you lose the bone that is around your teeth will fall out. So, periodontal disease is more often seen in adults, and the risk of it increases with age. Unfortunately, it seems to affect men more than women. I don't want to gross anybody out, so I tried to keep my pictures a little bit, anyways. Gum disease, as you see on the left side, it's the very start of gum disease, should I say. It's a little bit of redness around the gum line, and we see on the right picture, the gums look healthier. They're not red or inflamed. So when bacteria stays on the teeth for 24 hours, which is not that long, they start to form a film called plaque, which will eventually harden to tartar. And it doesn't mean you didn't brush your teeth. It just means that you brush like everybody else, but maybe you miss a spot here and there. And that's where that plaque, it's like that soft white film that we had talked about earlier, that will harden to become calculus. And calculus cannot be removed at home with a brush or a toothbrush. It really needs that sort of scraping effect that we have when we work at the dental clinic. So about half of all adults over 30 years age show some signs of gum disease. Some risk factors, evidently poor oral hygiene, diabetes puts you at a higher risk for gum disease, a weakened immune system, HIV, stress, hereditary factors, having crooked teeth. A lot of people who have very crooked teeth on the bottom here will have a lot of gum inflammation there. Defective fillings. So if your filling is very old, half broken, falling out, medications that can cause dry mouth, and even oral contraception, which causes hormone changes. But the big one is tobacco use. So people who smoke are at a much higher risk of periodontal disease. So let's talk about some warning signs. If you have bad breath, a bad taste in your mouth that won't go away, red, swollen, possibly tender or bleeding gums, it's painful when you chew on your teeth, some of your teeth have become loose, they feel sensitive, if you see your gums are starting to flip or detach a little bit, if you find that when you bite your teeth together, they're not closing the same way as they used to, and if you have a partial denture and you feel that when you're closing, it's not fitting as well as it used to, those could be signs of periodontal disease starting. It can be prevented and treated, and it's obviously best to start when it's still in the gingivitis phase because it's only the gums that are affected, so a good cleaning helps get you back on track. Whereas periodontal disease, which is the more severe form, it can be treated, but it may require a bit more extensive treatment. So meaning you go for cleanings and maybe deeper cleanings more often, and maybe sometimes corrective surgeries or medication. So we're going to talk a little bit about oral health problems. So cancer, most common in people over 55 years of age, in smokers, and those who are heavy drinkers. And what we've seen for people who have been treated with either chemotherapy or radiation therapy is that they can suffer from painful mouth ulcers, impaired taste, and dry mouth during their treatment, and sometimes even after the treatment, depending on how close the radiation was to their mouth. Some chronic diseases such as arthritis, heart disease, stroke, diabetes, emphysema, hepatitis C, liver conditions, obesity, they may increase the risk of having missing teeth and poor oral health as well. And we're going to go into that a little bit more. So for diabetics, for example, it's very important to basically just control the disease. And therefore, you will have a decreased risk for complications, including gum disease. And in fact, it's been proven that treating gum disease can even help lower your blood sugar levels. For nutrition, people with missing teeth, if they have partial dentures or full dentures, they tend to prefer softer, more easily chewed food. And as such, maybe they're not getting the proper nutrition that they need. And as I discussed earlier, some medications can cause dry mouth, which will reduce the flow of saliva and therefore have less of a natural cleansing of your mouth, which will increase your risk for cavities. So how can you maintain your oral health? Brushing with a fluoride toothpaste, I confirm, fluoride, twice a day and to floss daily. It's good to visit a dentist at least once a year, and even if you don't have natural teeth, it's important to go and check out if there is anything in the mouth that is of concern. Evidently not to use tobacco products and to limit alcoholic drinks as much as possible. So for the elderly, sometimes being disabled, homebound, or institutionalized can also increase the risk of poor oral health. So caretakers can help brushing and flossing of these people. We're going to talk a little bit about oral cancer. I don't know if people are as aware of how much of a screening the dentist can actually do to help prevent or catch cancers in the mouth and pharynx, like the top of the throat here, in its early stages. So these are statistics from the US, but in 2016, there were nearly 45,000 new cases of cancer in the oral cavity and pharynx, like I had said here. The 5-year survival rate was about 61%. And what risk behaviors? There was cigar or pipe smoking, smokeless tobacco, and excessive alcohol. So another virus which can cause cancer is called oral human papillomavirus. It is thought to be a sexually transmitted disease, but can be transmitted through sharing foods as well, forks, things like that. And it can cause cancers in the back of the throat. And basically when I do an exam, and it's just your general cleaning, you come, and I always palpate. So I massage the neck, under the jaw, the cheeks, and we look inside the mouth. I look like your tongue go from side to side, up, down, look at the back of your throat. And it is possible to find things. And they can be found early enough to help prevent any sort of long-term problems. So more positive notes. Let's go to dental treatments. So let's talk about some different types of treatments. So we have the fillings on the top left, some silver filling, white filling, veneers, which are sort of like a capping to help make the tooth look a little bit fancier, I guess. Crown, which is really like a capping. Bridge, which as you can see can help replace the missing tooth right over here. So you actually prepare these two teeth to then be able to clip it on to be able to have no hole here. Dentures, which can be a full denture or partial dentures, meaning replacing several teeth as necessary, and the famous implant. So implants, they basically act like your tooth replacement root. So as you see here, this is what your natural tooth would look like, and the implant is basically taking the same space that your tooth would in the bone. And then once you have the implant in place, you can do so many types of restorations on top of it. It could be a 1-unit crown to replace one tooth. It can be 2 implants that you then make a bridge that will link it to make 3 teeth now visible in the mouth. Or you can have no teeth at all and have multiple implants placed, which you can then put a bridge on top of, denture on top of. There's so many ways that we can use implants to restore people's mouths. I couldn't not talk about sleep apnea. It is something that most people do not know about. Basically, sleep apnea is when you stop breathing involuntarily for brief periods during the night, during your sleep. And most people don't even know that they have it because they're asleep. It is more common in men than women, but we see an increase of cases of sleep apnea in women after menopause. So basically, what does it sound like when somebody has sleep apnea? They snore quite frequently, or they sound like they're choking in their sleep. And it's basically their way, their body trying to get more air, and they're just not able to. And so that's why it sounds like they're choking. So some symptoms of it would be snoring, daytime sleepiness, just feeling groggy, sometimes being irritable. We've even seen things such as bedwetting or excessive urination in the nighttime, meaning you have to keep going to get up to go to the bathroom. Can cause depression, dry mouth, headaches, lack of concentration. It can increase memory loss, reduce sex drive, sore throat, and even teeth grinding at nighttime can be seen with sleep apnea. So what are things that you can do that are easy is to help, lose some weight if you sleep on your side, because it helps open your airways a little bit more. Decreasing alcohol consumption. But really, if you have more of a moderate to severe form of sleep apnea, it's more likely to be treated with an oral appliance or a nasal mask, which we call the CPAP machine. And it basically has oxygen with pressure going in to help keep your airways open and bring you the level of oxygen that you need. And in the most severe forms, it's also surgery that we need. So many health problems can arise from untreated sleep apnea. stroke, high blood pressure, headaches, diabetes, depression, heart failure, ADHD that can worsen, and just an overall lack of well-being. And you may even see increased accidents because people are just too groggy when they're at the wheel. So this was something that is actually quite common. It's been seen in up to 50% of the population. A lot of people have not been treated for it and don't really know a lot about it. But if it's something that you think that you have, then it's worth discussing with your dentist or a doctor, because it's something that is actually multifaceted. You have to go see a doctor and a dentist, and they work together. So, dental visits during COVID. So here are some new things that you probably have had if you've gone, and if not, what to expect. So a questionnaire is filled out with the generic questions about how you're feeling, if you've had any symptoms 24 hours prior to the appointment, and then again when you get to your appointment. We check your temperature. We don't really use the waiting room. We have an antiseptic mouthwash that you will use once you enter your own operatory. We have now closed operatory rooms. So a lot of clinics have either put indoors, plexiglass, some kind of curtain that closes, but they are closed doors. Everybody has increased their ventilation systems, and I have personally always had a sort of lab coat scrub that I will take off after every patient. I have my visor, I have my masks, I have my little head covering. You basically can't see much of me when I'm working. And we change that in between every patient. So I thought to be a little bit fun, we could do some true or false questions where we'll get to learn a little bit more than what I already talked about. So, all whitening products are good. I'm going to answer.
You want me to unmute everyone?
I don't know, do you want me to?
Yeah, we could do that. Okay, so then we'll give permission to everyone to unmute themselves. Go ahead, everyone.
False.
False, false, false.
Correct.
False.
So, different types of teeth whitening products. So there is the in-office teeth whitening.
Sorry, Lisa, I muted everyone.
Yeah, I know, good. You hear me?
Yeah.
Okay, so there's the in-office teeth bleaching. There are professional at-home trays where your dentist makes them for you based on a mold of your teeth, and then over-the-counter whitening products. I personally prefer the at-home trays because I find that people have less sensitivity with it. You then own the trays, like they belong to you. They are fitted to your teeth, and so you can continuously whiten your teeth over the years. You can decide in 2 years, I need a little touch up, you buy another syringe of whitening product, and there you go. You can keep whitening your teeth. I also think that you get less sensitivity to your teeth, and I definitely do not recommend the over-the-counter whitening because those trays or stickers or whatever that they give you are not shaped to your teeth or to your gums. And so we've seen people who have been burned. Literally the gums will have been burned from the product, and they've even bleached their gums. So, next, true or false? Whitening toothpaste whiten teeth.
Go ahead, everyone.
False.
No, false.
False.
True, false, true. Thank you.
Okay, so the answer is false. Whitening toothpastes are just more abrasive. They basically have a sandier grit, a more like sandpaper. They have a more sandier grit to them that helps remove the external stains from the teeth, but they don't actually whiten the tooth. And it actually can be quite bad for your teeth to be using such an abrasive product because you are then removing, slowly abrading the exterior surface of your tooth. And your teeth will actually become more yellow with time because the enamel layer, the outer layer, is actually the white layer, whereas the dentin, the second layer, is more of the yellow layer. And even if a toothpaste has peroxide, they aren't really left on the teeth for long enough to see a whitening benefit. So, true or false? You should brush your teeth before breakfast.
Go ahead, everyone. Go ahead.
Yes. True. True.
True.
True.
And after
True.
breakfast.
After
True.
breakfast. After breakfast.
So I knew this one would give mixed results.
I do it after breakfast because then I have clean teeth until at least lunchtime.
But I will tell you why. The answer is true in the sense that you should brush before you eat rather than after. Because think about it, you've just eaten, your pH level, your mouth is more acidic. You are then using this acid to brush your teeth. It is more abrasive. Whereas if you wait 30 minutes after you've eaten, the pH of your mouth has already gone back up a little bit more, meaning it's less acidic and therefore less abrasive to your teeth. Okay, another one. It is good to use mouthwash. True or false?
True. True.
True.
True.
True.
Very true.
False.
True.
True. True.
False. False.
Another tricky one.
Once a day.
This one is true and false
This time.
at the same time. So it depends what you're using the mouthwash for. So if you're using a high in fluoride mouthwash because you're at an increased risk for cavities, then yes, I totally agree, use the mouthwash. If you're using it because you have extremely sensitive teeth and you need it as a desensitizing agent, that's great. You can even be prescribed a mouthwash if you have perio disease, gum disease, because it can help protect you a little bit more. And salt water, which is really so easy, is actually very effective in soothing and healing canker sores. The main disadvantages with mouthwashes are actually from those that contain alcohol. And I will never suggest using a mouthwash that contains alcohol. There has been a link to oral cancer with those kinds of mouthwashes. They can also cause tooth sensitivity. They can irritate ulcers and canker sores. But mouthwash in general can mask bad breath. And bad breath can be a sign for us to know that there is something actually wrong. Another problem is that mouthwash can actually reduce the benefits of toothpaste. So if you do need to use a mouthwash, for example, like we said, for fluoride benefits or for desensitizing, maybe you can wait 30 minutes after brushing to use your mouthwash. At the end of the day, a Listerine type of product without alcohol that you rinse for will help kill bacteria, but it is normal to have bacteria, both good and bad, in your mouth. And it will kill those bacteria for about 30 minutes. And then your mouth becomes repopulated again with all of that bacteria. So you have to decide whether it's worth it or not for you. So, another controversial one. It is safe to drink coffee right after eating ice cream or vice versa.
False.
Yes. It's safe.
Jane.
False. False.
False.
How hot is the coffee?
Coffee.
Sandra Cuckoo.
How many?
Oh, we do it anyway.
Whether it's false or true, we do it.
It's
It's false. It's actually bad to do that. But basically, it's thermal expansion. So if you have your tooth and then a filling in it or a crown or bridge or whatever, they don't expand and contract at the same rate. So let's say you've eaten something hot, your tooth expands, and then you take something cold and it contracts, but the filling doesn't contract at the same rate. And so now you've created a little kind of micro gap between your and your tooth. And so you have risks of cracking your fillings, your crowns, and your bridges. So I like to wait for my mouth to calm down, to cool down in temperature before going from hot to cold, or vice versa. All right. A little bit of a repeat, but I want to say more information. You should rinse your mouth with water after brushing your teeth.
true.
Of
True.
course.
False.
Of course.
True.
Of course.
Of course. What?
You should not be rinsing out the toothpaste. Completely eliminating the benefits of using the toothpaste, especially in Quebec when you don't have any water with fluoride in it. You're buying Sensodyne, which can be a very expensive toothpaste, and you are just throwing it out. Basically, once you've rinsed your mouth, you don't get any of the benefits from the fluoride. Or if you're using Sensodyne, you should actually be just spitting it out and waiting 30 minutes before eating or drinking. That way, the Sensodyne, the desensitizing agent that helps your teeth feel less sensitive, will actually work. Otherwise, it's not really so useful. All right, so you should get a dental checkup before starting to take any osteoporosis medications.
Go ahead.
True.
True. So we've seen it very time and time again. It's what we call osteonecrosis of the jaw, and it can be extremely severe when you're taking these kinds of medication. So even though these medications will help strengthen the bone, they do that by sort of eliminating all the blood supply that comes to the bone. So if you have a dental procedure, for example, having a tooth extracted, you don't have enough blood flow to the bone to help heal after an extraction, after having an implant placed, after having some kind of surgery on the bone. And so we've seen problems after a surgery where the patient just doesn't heal. Basically, they're left with bone that will not heal. So it's important, and I'm not saying do not take the medication, I'm saying it's important that before you take the medication that you make sure that there's no very important treatment that you need to do, i.e. have a tooth removed, have an implant placed. Any sort of bigger treatment that needs to be done should be done before starting these medications. And we've seen throughout the years that doctors are becoming more and more in tune and telling patients before they put them on the medication, please make sure to go see your dentist first. So that's it. Any questions?
You can write them in the chat. You can put your hand up the old-fashioned way or put your reaction on. So I'm going to ask everyone to unmute yourselves. If you have a question, raise your hand. And okay,
I have
Andre
a
Hayim.
question.
Andre
but
Hayim.
you can't see my hand.
I see you.
Yes, you're saying that we don't have to, when we are brushing our teeth, we don't have to use the water to flush it out. How can we do that?
You just spit it out. You only need to spit out the
You
toothpaste.
spit.
You spit it out, but
Are you just spit
rinse.
out?
It's okay to leave
Okay.
a film of toothpaste on your teeth because that way you're actually getting the benefits of using the toothpaste, especially if you're using Sensodyne because you have sensitive teeth. There's no point of rinsing it out. You should really be brushing, spitting out all the excess. And if you need to go back and spit 5 minutes later because there's a little bit too much excess in your mouth, then go for it. But you shouldn't be rinsing it out.
That's fine.
Thank you, Lisa. Lily Dengur has a question. You have to unmute yourself, Lily. Lily?
Okay, what do you think about the electric toothbrush? And second, why don't we have fluoride in our water in Montreal?
I love the electric toothbrush. I think it is a great tool for people to use. It's just more efficient than if you were to brush your teeth yourself. It's just a lot more efficient. The one thing that I will say about the electric toothbrush is that you must use a soft bristled head. Do not buy the hard bristles. It has to be a soft bristle because the toothbrush is actually quite strong on its own. And if you're using a hard head, it's too abrasive on your teeth. And the other thing is that the brush is supposed to do the work. All you have to do is drag the brush from tooth to tooth. You don't need to go like this with the toothbrush. Just drag it from tooth to tooth.
Does it cause sensitivity or no?
Pardon?
Does it cause some sensitivity?
It can cause sensitivity if you are brushing too hard, but that's the same for a regular toothbrush. So it's, in general, after 3 months, your toothbrush should still look new. If the bristles are all flared, it's because you're brushing too hard. So that's a good sign to see. I mean, you've all been brushing your teeth for years now. You know what your toothbrush looks like after several months. If it looks like the bristles are frayed, it means you've been brushing way too hard, which is too abrasive, which is therefore taking off the external surface of your tooth that is really there to protect you.
And what about the fluoride in water?
So the fluoride in water is a very big controversial thing. I think we used to have it actually in Montreal in certain areas, and it became, I guess, political, and they decided to take it out. But there's no actual good reason. The dentists have been fighting for it to have it in the water. Fluoride toothpaste has been in, fluoride in water has been in use for 75 years now. There are no actual scientific studies that show that there are any risks by having fluoride in the water. Fluoride actually occurs naturally in the environment. It's in the earth. It's naturally in the environment. It's a natural mineral that we have, and there is no proof that it is detrimental to a person's health. And the amount that we are putting in the water is so low, is at a low dose that it will not cause any damages. For example, eating a whole tube of toothpaste will cause problems, but having a bit of fluoride in the water does not cause any problems.
Joyce Isaac has a question. Go ahead, Joyce. You have to unmute.
Very informative. Thank you. I wanted to know if any of the whitening processes contain ammonia or peroxide.
They contain peroxide.
They do. Okay.
There are two ingredients. You can use peroxide or you can use carbamide peroxide. There's two different types, but yes, they have peroxide.
We do have. Thank you.
Of course.
Ellie Hadid has a question. Go ahead, unmute yourself.
Is gene differs from one person to another with the teeth, or does it have to be like? I mean, people with bad genes, maybe they have to brush more or treat more their teeth.
Yeah, but it's not so clear as the hereditary factors. Yes, if you have a parent who has perio disease, you are probably more likely to have perio disease, but that doesn't mean it's a guarantee. And there's so many things that you can do by maintaining good oral hygiene that you will not be at risk for it. It's not, hereditary doesn't play as big of a role as people like to think.
Okay, thank you.
It doesn't play as big of a role. Everybody says, oh, my teeth are so bad because my mom's teeth were bad or my dad's teeth were bad. It doesn't play as big of a role. You're actually, you're responsible for your oral.
So then it's not true, yeah. Okay, Thank you.
Thank you, Lisa. Lisa, we have a few questions in the chat. I will read them.
So I just saw something pop up about water pick.
Yes.
Water pick can be good if you know how to use it properly. It can be bad if you don't use it properly because it's a pressure of water shooting bacteria potentially back under your gum. When you want to brush and floss, you're always trying to think of pushing the bacteria away from your tooth. So not rubbing things under your gum to pushing them up into your gum. So the water pick can be great, but if you're using it to shove the water back up into your gums, you're actually just pushing the bacteria further into the gum. So it depends. It depends how you use it. I would never add rose water or ginger.
No?
I wouldn't add anything to it, just use water.
There's another question in the chat.
Yeah.
When you suggest to have cheese after eating, does white cheese or soft cheese like yogurt also good?
Yogurt, not as much. Cheese in general. So cheese, I know we always say cheese. The pH of cheese is not quite 7, but it does help bring your pH up significantly. Like if you're thinking of a green apple or a coffee or balsamic vinegar, which is more like a pH of 2. When you go and have cheese, it's more of like a pH of 6 point something. So a cube of cheddar cheese or whatever is probably the best. I actually just like to chew a piece of sugar-free gum because it helps kind of pick up the pieces of food that's in between your teeth, and it helps increase the saliva to clean naturally.
Is white wine more detrimental to the teeth than red?
In the sense that it's a little bit more acidic, yes, but it doesn't stain. Red wine stains your teeth. But these are all external stains that come out with brushing or a whitening treatment.
What do you think of using Colgate Prevident fluoride toothpaste?
So I love that toothpaste. It is a very good toothpaste if you're at high risk for cavities. The one thing I would say again, you brush, you spit, you do not rinse your mouth, and you do not eat, drink, or rinse your mouth for 30 minutes. You basically want to leave a film of toothpaste on your teeth for 30 minutes.
Is it bad to add rose water to water or ginger? Will fresh ginger cause sensitivity in gums?
I do not think it will cause sensitivity. I don't know. It might be a bit acidic. I don't actually know that answer. It probably could be a little, so people like to add like lemon or something or lime into their drink, and it's fine. It's nice, it's tasty, but if you're going to be sipping on that all day, like I said, it's acidic. So it brings the pH down of your mouth, and it allows the bacteria to then produce the acid that will cause cavities. So I would assume ginger is the same thing.
I have a question from Facebook Live.
Yes.
Any safe at-home scaling methods for between visits?
I do that. I don't recommend that other people do that because I just don't think that you have the dexterity to do it. I can't actually recommend that. I would say just brushing and flossing, because to me, having you use a tool, and I've seen people do it before where they said they had tartar where it mostly forms on the bottom teeth, and they tried to remove the tartar themselves, but they end up cutting their gums, and then you're in a sort of worse off position because now you have gum recession as well as the tartar that's still there.
Are you good with brushing with baking soda?
Yes, but there's no fluoride. So does that mean you're making your own toothpaste with just baking soda? I mean, more abrasive and it doesn't have the benefits.
No, like just from time to time, just to do it for good measure.
Yeah, I mean, you can just make sure you're not being too rough and abrasive with it. I mean, we use that. Yeah, those are good. Those are good. That's good for people who have bridges or crowns or something to go underneath. But always, you just can't be too aggressive, because it's good to, when you're flossing, when you're using all these like extra, it's to massage the gum. You cannot go so hard that you're abusing the gum, because even though you think you're cleaning a lot, you're actually pushing the gum away, and that's where it causes recession. And there's always 2 millimeters between your gum and your bone. So if your gum is going down 2 millimeters, well, so is your bone.
What about veneers? Do you recommend it to adjust the color of yellowing teeth from drinking coffee?
I would go with a whitening first. I think that it is always better to preserve your natural teeth rather than putting something on top of them that that can break, that needs maintenance, etc. If you are able to, just for staining, do a whitening, then go for it. If you want to change the shape of your teeth, the alignment of the teeth, then maybe you're looking more at orthodontics or veneers, because veneers can help with both the shape, color, and alignment.
Dr. Bilbul is asking, what about mercury in fillings?
So there is also no scientific evidence yet, and we've been using these fillings for over 100 years. There is no scientific evidence that there is mercury being leached from these fillings once they are in the mouth. And in fact, more mercury is released when we are drilling out these fillings to replace them with white fillings. So I don't see any real reason from a mercury perspective as to why not to use silver fillings. There are some indications where silver fillings are better than white fillings. For the most part now, we are using white fillings. They are, I guess, nicer looking. They glue to the tooth, so you don't need to rely on retention, on like form of the tooth, but more just retention because it's gluing to the tooth. There's lots of reasons, but there are some indications when amalgam fillings, the silver fillings, are still used and are still better than some white fillings.
What's the difference between electric toothbrush and sonic toothbrush?
It's the same thing, like Sonicare versus Oral-B.
Valerie Toby, would you like to explain?
Very interesting stuff. I have to tell you about your water picture.
Okay.
Valerie, you wanted to ask about the electric toothbrush?
I don't see Valerie. Where is she?
But basically, all the electric toothbrushes are good. It's mostly how you use it. So, oh, she can't unmute it, Shira.
Where is she? You can unmute her. You're a host.
Okay.
Oh, there she is. Okay. Valerie, unmute yourself.
Hi, Lisa. First of all, thank you for a wonderful presentation. Both electric and sonic. The sonic is a much softer pulse. Is it better for the tooth?
I like softer. When I have my toothbrush, I always put it on the softer setting. I don't find it is too aggressive to use a hard bristled toothbrush and a more intense sort of vibration. I think the soft setting is good enough, and you basically go gently and you drag it from tooth to tooth. You are not rubbing your teeth. The toothbrush is doing the work for you.
Thank you.
We have Michael Goodbye, but I can't unmute you. Your audio is not showing.
He's unmuted. Oh, it says connecting.
Yeah. Okay, and until we wait for him,
Okay.
Michael Goodbye has a question. Oh, Michael, go ahead.
Am I on?
Yes. But Rachel has to turn off her Zoom, otherwise there's an echo.
Rach, I'm already on.
No.
Rach.
I muted him. Rachel wrote, are there alternatives to gum grafts?
Not really. I mean, you could do a filling depending on how bad it is. Like if you're doing the gum graft because it's a small sort of recession and your tooth is sensitive and you want to cover it from the tooth being sensitive, you could technically do a filling. If it's for sensitive teeth, it could be you apply a desensitizing agent. But if it's really to get coverage from where the gum was, there's not much other than a gum graft.
Lily Dangur has another question.
Yes, I want to ask you, there is a kind of a stick. It's called white. So I don't know if you see it. It's like a lipstick. It's called white. I didn't buy it. I won it at a Chabad meeting. Is it still available, this?
It's not so effective for whitening. It's not on your teeth for long enough to have a real effect.
You can't, they say leave it for 20 minutes. I don't know. No?
Yeah, but it's a stick.
But you have to wipe it. There are wipes with it, so you wipe it and then you apply this.
Yeah. I personally like the trays better because you can control where you're putting your product.
Oh, okay.
So the tray is kind of cut in a way that it follows the shape of your teeth.
Okay, Michael has joined Rachel. They could talk unechoed. Go ahead.
Hi, Lisa. How are you?
Good. How are you?
I just want can you expand on how a dentist gets involved with apnea?
Yes. So usually the dentist, you can talk about it with your dentist if you don't have a GP, and you have to go to a sleep apnea clinic. It's basically a sleep clinic where they will track the way you sleep. Either you can sleep there, which they're not really doing anymore, but you can take home a device where they will track your sleeping. So they'll see how many times you are waking up throughout the night, how many events of apnea meaning not breathing throughout the night that you are having. And with that, they are able to measure, do you have mild, moderate, or severe apnea? You have to go to a pneumologist. It is multifaceted. You have to work with multiple specialists. And so if you have more of a mild form of sleep apnea, you can just get a sort of mandibular, meaning lower jaw advancement device. So it's like a night guard that will push your lower jaw forward, which will then keep your throat open at nighttime. Because what happens at night is that your jaw goes backwards, your tongue goes back, blocks your airway level, and you're having a hard time getting the air. And so this device pushes your lower jaw forward, which then keeps your back airway open. But that's really only in the mild form. As you go more towards the moderate form, we use a CPAP, which is like a sort of mask that you wear, and you have pressurized oxygen coming in, which will help keep your airways open, but also supply you with the oxygen that you need. And in the most severe forms, we're talking about like jaw surgery to help advance your jaw forward. But that's really much more severe and not quite so common. But it's a multi specialty sort of group.
But how does a dentist get involved? Is that with the
dentist it has to be a specific dentist that is trained to make those appliances.
First. Oh, the appliance, right.
Yeah, the appliance you have to be specifically trained for that, but also the dentist has connections, maybe, sometimes not. We really actually in Quebec do not have enough specialists to send people who have sleep apnea. We don't have enough resources. So if you have a GP, you may actually be better off going through your GP to get treatment for that. We really just are not well set up for it. We're starting to do more trainings. This year has been a big year on sleep apnea. They're trying to find the resources because there's huge waiting lists for patients to see pneumologists. There's very few dentists that make the actual appliances. And at the end of the day, if you need a CPAP, it's not your dentist that's going to do it. So we're just a step. We're just a step in the process. We're not the whole process.
Thank you.
Of course.
Wilma Michelle, go ahead. Unmute yourself. Unmute yourself. Wilma.
Rach, what was your question?
Unmute. Can you hear me now?
Yep.
Can you please elaborate more about how to use the water pick flosser? Because I use it, but I'm new at it.
Yeah. It's kind of hard to describe. If you're using it because your dentist told you that you needed to, then obviously I agree to go ahead and use it. It's more about the angle, the way you're placing the angle for the water so that you're trying to clean sort of outside. It's hard to describe, but you're supposed to clean. You always want to picture that you want to take gunk and food and whatever out of the gum and not push it into the gum. So you can use it to go.
So you put it from up rather than.
Yeah, so you put it more like on a slant so that it's not just going straight up into the gum, but sort of up and out. And also you can go like in between the teeth like this. I do not say that a water pick replaces flossing. It
No,
does
no,
not.
I'm using it more because I'm going less for cleaning. I used to go every 4 months to clean the teeth, so I'm just using it more.
Right. I guess see what happens if you just started using it. See if you're extending the cleaning time, if you're able to maintain it a little bit better on your own. But definitely keep flossing.
Okay, thank you.
Of course.
Lisa, we have a question from Facebook Live. What about Colgate Optic toothpaste that contains 3% peroxide? Is it safe?
So toothpaste that are whitening, which is that toothpaste, it's the peroxide. It is more abrasive, so it will remove or it will damage your enamel layer, the outer layer of your tooth. And the peroxide is not actually on your teeth for long enough to make a huge whitening difference. So I think you're probably wasting your money on that product. I would probably say just go for a whitening, or if you find you're getting a lot of stains from coffee, which is very common, maybe buy 1 tube of whitening toothpaste and once a week you brush with a whitening toothpaste just to help maintain not having all those stains on your teeth. But it's not something that I would use twice a day.
Thank you, Lisa. Lisa, I want to thank you on behalf of the Sisterhood of the Spanish and Portuguese for an amazing evening. Yeah. We learned way more than I expected. You're right. It was very in-depth. I've never seen these pictures of teeth with fillings and
I tried to keep them clean.
Pardon me?
Tried to keep them as clean as possible.
Amazing. So thank you again. I'm going to ask everyone to unmute themselves so they can congratulate you themselves. Go ahead, everyone.
Well done.
Well done very much.
Thank you. Beautiful. Thank you very much.
Thank you.
A great doctor.
Thank you, everybody.
Great presentation.
That was so informative.
Thank you.
Lisa, you're absolutely amazing. Really, it was so informative and interesting.
Thank you, Lisa. Thank you.
Interest for the whole. There was so much information. Thank you. You really makes us feel proud.
Thank you. Thanks so much.
Thank you, Rachel, for hosting this wonderful event.
Thank you, Rachel.
I learned so much.
Good. I'm glad. Thank
Excellent.
you.
Bravo.
Great job, I have one more question, if you don't mind.
Of course.
Drinking water with lemon or eating or acidic foods, does that affect the teeth?
Yes. Yes, it does. Because it brings the pH back down. So it allows the bacteria, it basically gives the bacteria that causes cavities their source of food. They feed off on the acid or whatever. It's making your mouth acidic, which is more abrasive to the tooth, which means you're at an increased risk for cavities. That's why I say you want to drink coffee, go for it. You want to eat a bag full of sugar, go for it. But you don't want to eat it over hours of time. You don't want to leave your teeth sitting, floating in an acid. You want to have a shorter period of time where you eat the acidic thing, rinse out, bring the pH back up, whatever, but don't leave it there all day long.
Okay, is milk considered base? Like, should
no, milk is an acid, and that's why we also you never leave a bottle in a baby's mouth overnight, because that's how they wake up at like 2 years old. And I've seen it. I promise you, I've seen it on so many kids. 2 years old, and they've 2.5 years old even, and they have every single baby tooth has a cavity. Every single tooth, and they have to go under general anesthesia to get caps and fillings on every single tooth because they had milk left on their teeth overnight with the bottle. So milk has sugar in it.
Thank you.
Both breast milk and normal.
Thank you, Lisa. Thank you, Rachel. So I want to thank not only Lisa Kattan, but Rachel Gabay and the office staff of Françoise Babulot and Viola Tolchinsky and Linda Abudi for all their support.
And we want to thank you, Grace.
Yes, we want to thank all of you.
And thank you for a great turnout tonight. We had I saw at one point 73 people. So good job, Lisa. You attracted the whole community.
Very good job.
And good job for everybody for attending. I don't want you guys to forget, next week is Purim. We have sold 200 baskets so far.
Oh,
Mada Cummings, CSUQ is hoping to get more. Most of them are being donated to those organizations. If you want to buy a basket, feel free to call the office tomorrow. We have as well next Tuesday an amazing evening, Purim extravaganza starring Dr. Emil Shiri, also a dentist, but he's not acting as a dentist next week. We have Maître Robbie Shiri, but I don't think we call him Maître in Los Angeles. And we have Gilles Masri, who's going to sing songs. So we hope that you're all going to join us. Thank you again, Lisa Kattan, Dr. Lisa Kattan, for an amazing evening. And you can all applaud again.
Thank you, everyone.
Bravo.
Excellent,
Lisa. Bravo. Thank you.
Thank you, Lisa.
Thank you, everyone. Bye.
Thanks, Liz.
Bye. Thank you.
Amazing.
Thanks for watching.
Hi, Ronnie.
مرحبا لي كيفك؟
ما شاء الله.
Hi, Mom.
Hi, God bless. God bless. God bless.
Hi,
All the best. God bless.
Thank you. Thank you so much.
In good health always.
Thank you. Inshallah, for everyone, good health. Safe.
Amen, amen. Bye, everyone. Bye.
Love you all.
Kavod, everyone.
Good job, Lisa. Thank you. Bye, everyone.